Hi, I'm Dr. Kelly Starrett with H-Wave, and today we're talking about a phenomenon that affects millions of us, and that is low back pain. I'm here with the H-Wave, and I want to talk about one of the reasons that having H-Wave around, if you're prone to low back pain or chronic low back pain, or you have a history of low back pain, and why that's so powerful, is that one of the things that this gives us is what we call on-demand pain relief with our high-frequency setting. Oftentimes, if you've ever been laid low or had really debilitating low back pain, anytime your back is sore or a little tweaky, we tend to perseverate, we tend to catastrophize that we know what's next, which is debilitating low back pain, where I can't get up, I may not go to work, I might not be able to engage with my family, and that is very scary. Especially when people have kind of chronic experienced low back pain, and now maybe they've had surgery or they've tweaked their back significantly in the past, or they're living with just an old and cold stable disc herniation that every once in a while kind of raises its hand and asks for attention. What's nice about having an H-Wave on hand is that this allows us to quickly de-escalate and gives this person loci of control, gives her agency. Because when I have low back pain and I'm worried it's going to sideline my ability to enjoy life, when we suddenly can apply some high frequency energy to the low back, that means I can break that spasm cycle, I can give myself some relief, and I can interrupt that cascade of catastrophe and spasm and potentially a lot of pain down the line. And so in this situation, all we do is put a pad placement that's either going to be sort of thinking, hey, I want to cross the spine because I have a single area, or in this situation, I have her set up where she's making an X across the spine. And remember that high frequency is giving me some sort of analgesia, some pain relief in this area between and around the pads. And once we're sort of cooking with high frequency, Juliet will just say, hey, I just have some pleasant sort of numbness. I'm no longer aware of what's going on in this region. And that's really the goal. We spread the pads out a little bit, get across, dial this thing up, and give Juliet some on-demand pain relief. And what's important about that is that we can run this thing for an hour, take a break, give the skin a break, and then we'll have many hours of follow-up pain relief after running that thing for 45 minutes to an hour. In the worst case or worst pain scenarios, we can run it for an hour, take a break, run it for an hour, and then just keep an eye on our skin. But ultimately, this gives Juliet the opportunity to say, hey, I've tweaked my back. I know I'm going to tweak my back again, and I can control those symptoms. I can break and interrupt that signal. And this is why this on-demand pain relief is so powerful. So again, if you have a history of low back pain, you've tweaked yourself, you're afraid, you know what the pre-cues are coming, interrupt those cues, get up from the table, make a different decision. Grab H-Wave today because it'll allow you to stop that catastrophizing and get back to your life.